Hi everyone, I'm Emma Snook, and I'm going to talk a little bit about cognitive impairment and what exactly it is and how we can help students with cognitive impairment in the classroom, whether we're teachers or student counselors. So, cognitive impairment is characterized by a combination of deficits in both cognitive functioning and adaptive behavior. The intellectual functioning level and adaptive skills of students with cognitive impairment will fall below the average for a child of their chronological age. And developmental delays can be seen in a child's social skills, emotional development, communication capabilities, physical functioning, and academic skills. Cognitive impairment was formerly known as mental retardation. However, this term has been associated with negative connotations, so the term cognitive impairment was created. In terms of intellectual functioning and adaptive behavior, there are many limitations. In intellectual functioning, limitations often include difficulties in memory recall, task and skill generalization, and these students may demonstrate a tendency towards low motivation and learned helplessness. In terms of adaptive behavior, the limitations may include difficulties in conceptual skills, social skills, and practical skills. Other signs and symptoms of cognitive impairment include delays in reaching early childhood developmental milestones, a short attention span, lack of curiosity, limited or inconsistent communication skills, lack of age-appropriate self-help and self-care skills, and many others. So these signs and symptoms can be seen as young as 2 years of age, and the symptoms will occur at varying levels depending on the severity of the disorder. Prevalence ratings for intellectual disabilities are actually inconsistent because the signs and symptoms are often hidden within other disability classifications. However, it is the most common developmental disorder, occurring in approximately 12 out of every 1,000 children. So if you've taken an assessments class, you know that there are many different tools used to measure the cognitive functioning of children. The most common uses of measure of cognitive functioning in children are the Stanford-Binet Intelligence Scale, the Wechsler Intelligence Scale for Children, and the Wechsler Preschool and Primary Scale of Intelligence Revised. These tools will be selected based on the child's age and the aspect that's being measured. There are 3 different levels of cognitive impairment. However, if a student is evaluated and scores an IQ of 70 or lower, he or she is considered to have an intellectual disability. There's mild cognitive disability, moderate cognitive disability, and severe cognitive disability. Mild cognitive disability accounts for around 85% of all cognitive disabilities. Children in this category have an IQ score between 55 and 70 and are usually included in general ed classrooms. Moderate cognitive disability includes students who have an IQ score between 30 and 55, and severe cognitive disability includes children with IQ scores that fall under 30, and these students will also have few communication skills and will also need direct supervision. Of all cognitive disabilities, only about 3 to 4% of children have severe cognitive disability. Even though there are different levels of cognitive impairment, there are a few characteristics that children will display in all levels. This includes a difficulty remembering new information, difficulty generating skills, and a difficulty with internal motivation. In return, these students may need information to be introduced multiple times before the new information or skills acquired. These students may also have difficulty transferring skills learned in one environment to another, and these individuals require external motivation before acting. Cognitive impairment can also be seen in other disabilities. This includes a learning disability, dyslexia, attention deficit hyperactivity disorder, a brain injury, and genetic disability. Cognitive impairment has a significant impact on learning. However, with the appropriate support, these students can achieve a high quality of life. If academic support is not implemented, a student with cognitive impairment will fall further behind as they get older. The curriculum and instructional modifications help students with cognitive impairments to help reach their potential in academics. However, independence and self-reliance should always be the primary goals of instructional strategies. Strategies that can be implemented for students with intellectual disabilities include teaching one concept or activity or component at a time, Teaching one step at a time will help support memorization and sequencing. Teach in small groups or one-on-one. Always provide multiple opportunities to practice skills in a number of different settings. And use physical and verbal prompting to guide correct responses and provide specific verbal praise to reinforce those responses. So thank you guys so much for listening, and I hope this helped you understand what cognitive impairment is and give you a few ideas of how to help these students in the classroom. Thank you for listening.